There are multiple different causes of arthritis. There's over 100 causes of arthritis, actually. And we tend to divide them up in two different groups. There's the inflammatory type arthritis and the non-inflammatory type of arthritis. 90 of those 100 types of arthritis are inflammatory. Unfortunately, they're not very common. The majority of people get a non-inflammatory type of arthritis, wear and tear arthritis, osteoarthritis, degenerative joint disease. They're all relatively similar in meaning. There's a genetic component of arthritis, but there's also an overuse component. And so if someone has a family history of arthritis, meaning if you've had a mom, dad, brother, sister, grandparent, cousin who's had to have a hip or a knee replacement, it probably wouldn't be the best thing to do to be a runner for exercise. You would be better to do what we call non-impact exercising, like swimming, bicycling, elliptical. If someone has had surgery on a hip or a knee, that also makes that joint not quite normal. Even the surgery could have gone perfect, but if you've had surgery on a hip or a knee, we would say the mechanics of that joint are not optimal, and it would be better to do non-impact exercise. The number one cause of hip and knee arthritis in the United States is being overweight. That is the number one cause of hip and knee arthritis in the United States. And the hard part is, I don't know an easy way to lose weight. But every pound that someone carries in their arms or on their body, every 1 pound, puts 4 pounds of stress on the knee and 6 pounds of stress on the hip joint. So if someone is carrying 25 extra pounds on their body, that's 100 more pounds of stress on the knee joint and 150 pounds more stress on the hip joint. So that's a big deal. That's a big deal. And so we would encourage people, if they have early arthritis, for example, in a hip or a knee, and they want to know, well, how can I slow down the hip or knee arthritis from progressing? I would avoid running and jumping for exercise because that pounding is hard on the joint. And we would encourage swimming, bicycling, elliptical for exercise, so non-impact type exercise. We would encourage them to try to avoid a job where they have to carry heavy things all day long for the reasons I just mentioned. And by the same token, to try to get as close to their ideal weight as we can. People ask, well, what about glucosamine? And it's controversial. It's controversial if it does anything. I've never seen a study that says it will hurt you, but I don't know for sure if it will help you. And those are the main things somebody can do to try to slow down the progression of arthritis.